We're talking about gender inequity in healthcare today. How do we improve that? How do we bridge the gap? This is Dr. Elsie Coe with lead physician. I'm here with Dr. Sasha Shillcutt. She's a cardiac anesthesiologist in Nebraska. She's a physician leader, researcher, blogger, author of a book called Between Grit and Grace, and she leads conferences called Brave Enough, which are women empowering conferences. Thank you so much for being here, Sasha.
Hi, how are you? I'm so excited to be here today with you.
Thank you so much. I have so many questions to ask you, but let's talk about gender equity and why you've been speaking about that, what you do, your purpose.
I think it's really important from a leadership perspective to recognize that the more equity we have, the more healthy our organizations are. And actually, the better our bottom line is for our organizations. So, what we know about the business sector that can really apply to healthcare as well is the more women that are on a board of an organization, the healthier that organization is, the higher engagement the employees have, the better customer sales, the better the bottom line, the more innovative those companies are for Fortune 500 companies. And when you look at healthcare, the majority of healthcare for the last 100 years has really been built around this persona that our leaders in healthcare are men. And for most deans of medical schools, we know that I think it's less than 10% of all healthcare or medical deans are women. For CMOs and CEOs, it's even lower, or it's a little higher on the hospital level, but not much. And there's a fall off when you get to that third or fourth managerial level in healthcare for women. But what's interesting is that women make up 87% of healthcare, the workforce. So we are a workforce that is vast majority of our healthcare workforce is women. But who leads us, it's the completely flipped opposite of that. 87, 80, 90% of our leaders in healthcare are men. So there's a disconnect. There's a disconnect between who is actually working and really perpetuating healthcare in our country and who is leading. And that disconnect can lead to significant things like pay inequity, microaggressions, bias, discrimination, burnout, which is a huge problem. And so for me as a woman who really started my career about 17 years ago in medicine, wanting to be a leader, wanting to be a good leader, all of the people that I looked up to were men. So when I would speak like them or I would act like them, there was a disconnect in the culture around me. Like people weren't used to women speaking like that, or they would get uncomfortable with me acting the way that a male leader would act. And instead of me recognizing, because I was junior and young and ambitious and wanting to be a really good leader, instead of me recognizing, oh, that's just because the culture is so used to 90% of the time when a leader speaks, it's with a male voice. I took that personally and I started thinking, what's wrong with me? I must not be a good leader. I must not be speaking appropriately, or I must not be using my authority appropriately. And that's what really drew me into this work, is because I myself, as a woman leader, became burned out. I felt like I couldn't be authentic. I couldn't use my voice the same as my male colleagues could. And I realized I want to be a leader that other women see and other women can be. They have the ability to be their own style of leadership as a woman. And so that's what really drew me into this gender equity work.
Right. There's 2 points I want to make from what you said, and thank you so much for that. One is I absolutely 100% agree with what you're saying first about why we need to have more equity in the workplace and what it does for businesses. We know that 80% of the women, 80% of the people who actually control the spending on healthcare are actually women. So why aren't we catering to the customers who are spending the money to get the business? And then the other thing I wanted to say is, have you changed your tune since you talk about how the way you spoke, the way you acted, being more male-like to be included or to fit that model? Have you changed? How has that changed over the years?
Great question. Definitely has changed. And that's really what I talk about in my book, Between Grit and Grace, because I think most of us as human beings, especially if we aspire to be leaders or in a position of leadership, we have to engage with that grittier part of ourselves at times. It may be uncomfortable, but maybe we have to speak up, or maybe we have to deliver news to our group of employees that is not positive, but has to be done. Maybe we have to call out some inequity. Maybe we have to make a hard decision, and we have to really be gritty, and we have to be, really authoritative, because we are paid to do so. And it may feel uncomfortable for us to also at the same time have to tap into that more graceful side of ourselves. And I think this is for me how I've changed is there are times where I am very authoritative and I speak with authority and I speak very bluntly and direct. And I may get backlash from people around me. Whereas before that would cause me great stress and duress, I just know that that's not me being incorrect or not me being inappropriate. It's our culture, and backlash is to be expected, and it's okay. At the same time, there were times early in my career where I would have a lot of empathy. Maybe I'm talking with the patient's family and I would get choked up because I knew that I don't know if I'm going to get this patient out of surgery. And that's a part of my empathetic side as a woman that I possess. And I would push that down, like, because I didn't want anyone to see me, getting emotional or be seen as weak. And now I realize, like, that's just who I am. I don't have any problem getting emotional or empathetic with a family or having a moment with a family. I can be both of those things. I can be that gritty leader who's authoritative, and I can also show empathy. It doesn't mean that I'm a weak leader. It doesn't mean that I shouldn't show that in the workplace. That's who I was created to be. So I'm so much more confident in my abilities to lead and how I demonstrate leadership that's different than a man, and that's totally okay. So I've definitely changed in the way that I go home at night, where I'm not like doing the replay, like, oh, should I have spoke softer, or should I have not gotten emotional in pre-op, or I don't do that anymore to myself, Elsie. I just say, this is who I am, and I'm an authentic leader. And I think that I'm opening doors, or I hope to be opening doors for other women to lead the same way.
Yeah, I agree. I think, when we came out of training, a lot of us didn't know how to act. And as for myself, 2 years out of fellowship and thrown into a medical director position, heading people within my surgical center, all I knew was to give command. So you just being, and it wasn't really my authentic self. It was what I thought I should be. So what you're saying is we need to think more about who we really are and actually reflect on that as we communicate with people, whether it's in a very high pressure situation or versus in a very emotional situation. It's learning to communicate authentically, as who you really are, and also communicating at the level of that person who you're speaking to. Thank you for
Yes.
that. So tell us a little bit more about you have a whole conference called Brave Enough, and I think there's a couple workshops related to that. Can you tell us a little bit about that and what that means for empowering women?
Yeah, so I have a conference and retreat every year and a class every year where I teach women really how to find their authentic voice and we go through so many different things. We cover bias, discrimination, negotiation. We really get down to understanding backlash in the workplace, and that it's okay when you experience backlash, it doesn't mean that you're possibly doing something wrong, but how important it is for us to self-reflect. And that conference is every year in September or in the fall, October-ish. We didn't have it last year. It was virtual. This year we're having a smaller conference, but vaccinated conference, which I'm really excited about. And we are going to be talking everything from leadership failures. We have some CEOs coming to speak to us. We have some lawyers coming to talk to us on how we use our voice and how we negotiate for the things that we need for our patients or our families or ourselves. And also a huge well-being piece tied into that part of being a healthy leader, part of being a healthy physician, in my opinion, is being well and and understanding what boundaries are, which I know I didn't learn. No one taught me that you're going to have to say no, you're going to have to set healthy boundaries. You are the only person worried about your own health and well-being. Even though you work in healthcare, you have to worry about yourself. So we really go through workshops on that as well, and how to recognize symptoms that are maybe unhealthy for you or in your workplace, and how to kind of turn that around.
That's good. I think I need some of that, especially that well-being piece. Oh, and probably overcoming overwhelm when there's so much on our plate. How do we deal with that? How do we focus? That's fantastic. Thank you so much for that. So, how do people find out that website
So
to
you
sign
can
up?
go to becomebraveenough.com or braveenoughconference.com. Either one of those will lead you there. And, my passion is, I think sometimes we as leaders can become so isolated. It's so overwhelming. Like you said, your plate every day is full. The last thing that you have time for is to maybe connect with another woman or another leader. And that is so important, we do, but it seems selfish. And it's like the last thing that we have time for after our work and our family, or our own health. And so part of the reason that I do the work through Brave Enough is just to bring peers together for peer support and peer coaching. There's so much coaching that goes on amongst the physicians themselves. Like, I just kind of see myself as a catalyst. I don't even really call myself a coach, because most of the time someone else has gone through the problem you're facing and has figured it out. And so if we just bring each other together in an environment, and that's what really happens at the conference and at the retreats and through my classes, it's amazing to see women supporting each other and coming together and helping each other, get that promotion or learn how to negotiate for whatever resource they need in their hospital, or learn how to set healthy boundaries and get back to their own health.
That's a great empowering tool for women. Thank you so much for doing that, Sasha. I just want to ask you one last thing as we close up this podcast. I wanted to ask you, how do we bring all of that to the workplace, and how do we also draw men into this piece where we're trying to bring equity more to the workplace?
Yeah, so it's a very common misconception that equity is really up to the marginalized group to fix, right?
Right.
So women fix yourselves. People of color, you should fix the problem, but that's actually really not true. I always say equity is the work of leaders, good leaders, and if you want your culture to be strong, if you want engagement from your employees, you've got to have diverse, inclusive environments. So it's really kind of the foundation of your leadership model. And I present it like that because we need leaders to support these efforts. We really need them to demonstrate them. And most of the time in healthcare, our leaders are men. So I see it as I see them as so critical to this piece and really important to get them on board. And the best way to do that is just to partner with them. It's not to make men feel like somehow they've done something wrong or they're doing something wrong, or that this is like scary work that's going to reveal some huge bias they have. First of all, we all have biases. Every organization, every healthcare system, every leader has bias. So we can't escape it. We might as well work on it together. And so I really see empowering men to come and join and really honestly like lead these efforts. It's so empowering to see a male ally doing that. And it takes 1 to 2 male allies to really kind of flip the whole switch, right? To go, wait a minute, why don't we know our pay equity data? We probably should know that. Let's look at it. It takes 1 or 2 men to kind of really change the environment. So I constantly am encouraging and empowering them to do that, and making sure they feel welcome to talk about equity and talk about diversity and inclusion, and not feel like it's something that they don't have a foothold in.
So they can join the conference if they want to. Is that what you're saying, Sasha?
Yes, 100%, 100%. We have a couple male speakers as well.
Oh, great. That's nice to hear. So, yeah, I agree. Culture really starts from the top. So, if you're a male leader and you want to help empower women, join this conference and join us and come speak. And I invite you to reach out to me at info@drlcco.com if you want to speak on gender equity. I would love to hear from you. And remember, like it's from generations past. It's not just the men in this generation in our lifetime. It's all the thoughts and ideas and paradigms that have been passed from people who have passed away. So we're trying to just make that change. We see progress, and in order to continue with that progress, we need to work together. Thank you so much, Sasha. Tell us how we can reach out to you and learn more, and what's the best way to reach out?
Yeah, so I post a lot of really encouraging, empowering things on social media. So you can follow me on Instagram or Facebook on my page at becomebraveenough.com. I'm also on LinkedIn at Sasha Shillcutt. And probably the easiest way is I sign up for my newsletter. I send out a 30-second encouraging read for leaders every Friday, and you can sign up for that at becomebraveenough.com.
Thank you so much, everyone. Um, h- Please comment and please like, so that we know that you want to hear more about physician leadership topics. And I really appreciate the support. Thank you, Sasha, and have a great Sunday, everyone.